Hey y'all, so it's Nurse Care, unorthodox nurse, here to talk about stroke, also known as CVA, which is a cerebrovascular accident. So, a stroke. What is a stroke? It's basically when the brain is deprived of oxygen, and there's three different types of stroke. We're going to start with ischemic. Ischemic is when there is the blood vessel in the brain is blocked. It's normally blocked by clot or narrowing of the artery because of plaque buildup, which is normally caused by like cholesterol, right? It's basically fatty deposits. So there's also two different types of ischemic strokes. So you have thrombosis. That is when that blood clot is actually formed in the brain, and you have embolus. That's when that's when the clot was formed somewhere else, normally the legs, the heart, and it travels to the brain. Right? You have hemorrhagic. That is a brain bleed. That is normally caused by like an aneurysm. Aneurysms, hemorrhagics, strokes are normally caused because of hypertension. And you have a TIA. So a TIA is a transient ischemic attack. It's basically a mini stroke. It's a temporary block in the brain, right, of the blood vessel. And that tends to have signs and symptoms of a stroke, but it's very short. So those signs and symptoms, they don't last for more than 5 minutes, but it's definitely like a wake-up call for you to kind of start changing some things in your life. So there's many risk factors for a stroke, right? You have hypertension, diabetes, high cholesterol, obesity, stress, birth control pills, blood thinners, smoking, right? So it's always the same thing. A lot of these things that is preventable. So the doctors or providers would normally order a CAT scan, an MRI, a lipid panel, again, because high cholesterol could be a reason, someone has some narrowings in arteries, PT-INRs, EKGs, right? Overall, right, patients can present with symptoms such as headaches, nausea, vomiting, vision changes, so blurry vision, dysphagia, that's when they have a hard time swallowing, speech changes, that's when you get the slurring of the speech, ataxia, that is loss of coordination, that's when they really can't walk properly, decreased sensation, so they'll tend to have, they really can't feel hot and cold as you normally would, facial drooping, unilateral weakness, right? So, if a patient presented with a stroke on the left side of the brain is where the logic lies. So that's where the language is, your problem solving skills, numbers, everything's on the left side. So you're gonna have impaired speech, they won't be able to really do problem solving for you. They'll be depressed and they'll also be anxious. So the way that the brain works is pretty interesting. It's actual contralateral. So if a person has a left-sided stroke, you'll actually get right side neglect. So left-sided stroke, you'll get right side neglect. And that's like with the legs and the arms. On the right side of the brain, that's where your creativity lies. So if a person has a stroke on the right side, they'll be very impulsive, they'll have poor judgment, so you have to be really, really careful with them because it ain't 1 + 1 ain't equaling 2. And again, since it's contralateral, you'll actually have the left side neglect from a right-sided stroke, okay? Something that's really, really important when you're dealing with someone with a stroke is communication. So some of these patients have aphasia. Aphasia is when patients cannot communicate effectively. So expressive aphasia is when that person understands everything that you're saying, but they're not able to communicate back with you. So they tend to get very, very frustrated. So it's really best that you find a way to communicate with them because you don't want them getting so frustrated that they're working themselves up. You also have receptive aphasia. That's when they cannot understand what you're saying, but they can verbally talk themselves. And you have global is when they can't understand you and they can't talk. So it's very, very difficult. You'll find your ways to make, meet their needs, but it can be very difficult. So, medications, right? There's different type of medications that will be given for different reasons. So for ischemic, right, that's where you have a blood clot. You're gonna want thrombolytics. That's basically a clot, like to bust the clot. You're gonna want anticoagulants. All right, you're gonna want to thin out that blood. But for hemorrhagic, that's where a patient is bleeding. You're not going to give them those medications that we gave previously. So you would give them like their hypertension medications, make sure their hypertension is being controlled. You're going to want to give them statins, make sure their high cholesterol is being controlled, or we don't want them to develop any high cholesterol. And then also something that's really important, if a patient is having a TIA, right, that mini stroke, if we're able to determine the facial drooping, the arms, being flaccid, the speech slurred, right? And we know the time that all of these things happen. If we can determine that within 4.5 hours, we're able to give them a TPA, right? They're in the window, they're in the clear for that. Now for interventions, if you had a family member or if you're in a hospital, something that's super, super, super important, right? You always want to make sure that their airway is painted. You want to make sure that they're not choking, because sometimes you don't know if they can swallow properly, and it's something that can come and go, so you have to be really on top of it. You also want to keep them safe. So again, the poor judgment, they're impulsive, they're depressed, they have anxiety. It's also really difficult for someone to just randomly have a stroke. If you've been doing something your whole life, being independent, walking, running, and you have a stroke and all of a sudden, instantly, you have all of these restrictions or limitations, it's very difficult, So you definitely want to keep them safe. You want to make sure that their vital signs always being checked. And you also want to be giving them stool softeners, right? You don't want them straining. There's so many other things that can be followed. Doctors may put them on dietary restrictions. Again, everything is dependent upon the situation, but overall, this is kind of what stroke is, and I hope you guys found this video interesting or helpful. Again, I love to do my disclaimers because this is more of a mini lesson plan. It's not really for you to study from. It's just so you can get an overall view of what a stroke is. Please leave some comments, some suggestions at the bottom, any feedback. I love it. It helps me improve, and I appreciate you guys watching my video. Yeah, thank you very much. Bye, y'all.